Are you able to understand the importance of commitment in being able to actually self-actualize or make that a reality?
Some guys have taken the concept of resilience, really ran with it, and I don't know how I feel about it. Hey everybody, welcome back to the channel. This is Dr. B, and today's topic we will consider resilience and trauma within the world of talk therapy, psychology. Again, today I have a special guest, Parham. A lot of you know him. He is medical clinical director of Buckeye Recovery and part owner. He is a professor locally at one of the junior colleges. He has extensive resume in addiction. In addition, look below for all of his links. Let's get started. Hey, Parham, how are you?
What's up, Dr. B? Happy to be back another week and happy to be talking about a very important topic that is very near and dear to my heart and a significant component of the healing and recovery journey for a lot of human beings.
Fantastic. I think this is important. I want myself to understand some of this, because this is what you do. This is your background. This is your training. I do have some understanding of it coming from a kind of a different place. And first, I want to get your take on it. I do know that the concept, the psychological concept, and I'm not putting a name on it, whether this is a trait, this is something, the concept of resilience is an integral component in the issue of the impact on trauma and the therapy in that space. Is that correct? Am I describing that correctly?
Yeah, absolutely. I mean, resilience is the main ingredient, the main element that allows an individual to be able to continue moving forward. So what is resilience, right? Let's talk about that.
Yeah. Before we do that, I want to know a little bit more because I want you to educate me on in particular, because this is what you do. You do therapy, you work with addicts, families, kids. You have a very heavy background in all this stuff. I want to get educated because my first question is, I guess, let me start with a question so we can kind of distill the issue. In the past, I've owned intensive outpatient treatments, mental health things for substance abuse and stuff like that. I've read a lot of the notes on kids and stuff like that. I do not recall ever seeing the term resilience pop up in any of that. First, tell me how it plays in the therapeutic role in that space, how you guys utilize it, how you manipulate the concept, how you guys look at it. Then we'll go, me and you, what is resilience? And then, I have some takes on it, but can we start that way?
Yeah, absolutely. Background. So resilience it's a trait. It is a characteristic, we'll call it. And the main component of it, from my perspective at least, is how fast an individual is able to adapt or adopt to changes and the impact, for example, their emotion dysregulation. So if somebody experiences some type of trauma, some type of traumatic effect, the resiliency of that individual is how fast they're able to bounce back or to regain composure, regain self, to continue moving forward. So resiliency is the key that allows us to stop the regression after some type of a traumatic event.
Okay. And in substance abuse, mental health treatment, is it an important component of the therapists that work that space? Do they look at that issue? Because, trauma is a big buzzword nowadays in substance abuse and, the root of it. That being said, does it play a big role in the therapeutic component?
It needs to be. I think it needs to be, because if somebody's trying to heal and someone's trying to work through their past traumas or traumas they're currently experiencing right now, they're going to reach a point. Let's say they discontinue the use of drugs and alcohol. So the coping skill that they were using is no longer a part of their active day-to-day life or specific type of behaviors, compulsive behaviors, maladaptive behaviors. When you remove those, now the individual is almost like a raw nerve. And resiliency is when they experience triggers or stuff comes up and they want to revert back to a negative coping skill, is how can they navigate through that discomfort, at what pace, at what kind of speed, at what cadence, in order to continue the forward progress. Now, here's the thing. The forward progress doesn't have to be extreme. It doesn't have to be so obvious that this person is moving forward. Sometimes it might just be a small incremental step in the right direction. I always say direction is more important than speed. And resiliency is the kind of the vehicle, the tool that allows us to move from a dysregulated state to a place of feeling more in ourselves.
Okay. You said the tool.
Yeah.
So that brings up a lot of questions for me, because when you said that, is it something that could be taught?
Yeah.
It can?
I believe so, yeah. I mean, here's the thing. The resiliency, they call it the 4 C's, they call it the 5 C's, whatever you want to call them. And there's different literature. There's the 3 C's, but the components are this, is connection, right? Is do you have social, familial connections that are deep and meaningful, and you know that those individuals, whether they're family of choice or family of origin, do those people have your best interest in mind? You know, can you stay connected to those people, the connections that we have? The next one is our communication skills. Are you able to learn? And some of these are naturally and organically, and some of them might be, taught, or a combination of both. But can you be able to communicate your internal world, your thoughts, your feelings, your experiences effectively to another person to feel connected? The next one that comes down is going to go down to something called our commitment. Is once you decide that I'm going to work through this trauma, I'm going to heal from my past wounds, are you able to understand the importance of commitment in being able to actually self-actualize or make that a reality? So those are the really 3 important things that are needed. And when you bring those up in a therapeutic session, when you bring those up in a therapeutic space, it allows people to take some of the organic, natural things that all human beings have. We all know the power of community. We all know the power of connection. We all know the power of commitment. But when you experience trauma, what's the first thing that happens? Those are all areas in our life that are impaired. And so, yeah, you could bring them into the therapeutic space and increase resiliency that way.
So, in your view, everyone has resilience,
yeah.
and some have less or more.
Yeah.
In developmental years, is resilience something that we were supposed to be taught, given, developed into? Because, I do know this, the curve of resilience is a bell curve, okay? And we want to push more people on that side.
Sure.
And some guys have taken the concept of resilience, really ran with it, and I don't know how I feel about it. Because for me, the first question I have, is it a trait, like a personality? If it is, it's difficult to change what your natural resilience is, or however it came up. Number 2, if it just is, and there's no way to impart resilience on an individual client or patient, is there any value in talking about it? That being said, I don't believe those things, but these are, I think, and tell me if I'm wrong, in the greater psychology world of the theoreticians, it's a discussion. My suspicions of it are the group of school of thought, I think they call them positive psychology. Some of those guys are at Harvard, some of them are at Berkeley, I forgot their names. They've ran with this, and they're big proponents of teaching resilience. And the places you see it, there are 2 main places. One of the places it started to take off was in the U.S. military, right? Teaching resilience. And then from there, now it's become a big part of executive corporate psychology. And for me, I make it a very simple definition: the ability of an individual to bounce back from adversity. Okay. And so what do you need to do that? And what needs to happen? There has to be learning and a self-reflection narrative kind of going on. Interestingly, as a side note, I think certain personality disorders, by nature of the intrapsychic dynamic of that personality disorder, they lack all resilience, because life is a Groundhog's Day of repetitive problems of the same type, which is interesting for me, because it's almost like, certain narcissistic and even other ones lack resilience. But all of that being said, and my suspicions of it are because it is in the corporate world, and they push it, and they push it in the military, and it raises some concerns. How natural is that, right? And could it have a negative impact? At the same time, I see the importance of it in trauma and substance abuse. In fact, my natural tendency, without too much critical thought, is to say recovering addicts are the poster children of resilience. That is my idea. Okay, if that's true, which I think it is, what is it that I'm referring to, right? They were able to take adversity, but even more so, an adversity that had wrapped itself into their central nervous system and created a physiological impulsion, right?
Yeah.
Natural state to cope with stress. They stopped that, were able to survive through that, and have now moved on. That is something that is a fact.
Yeah.
If they can do that and actually recognize that, I actually think sky's the limit for them.
Sure.
In many, many, many ways.
Yeah.
So
I have a few points here that'll piggyback on what you're saying.
go ahead.
So
that's my thoughts on it.
no, and your thoughts are very. Personally, I'm just kind of running through and trying to consider if it's something you're born with as a trait, then is there any way to increase or develop it as you go on? But something came up to me organically in this conversation, and I think it's important because, especially when we talk about certain personality disorders, and they just, they lack
I use that to understand it for myself.
But it goes down. I know you're a big advocate of the, object attachment theories, we'll call them, and I do believe that all human beings have the kind of the incubator for their resiliency, so it's already in them, kind of like a trait. But the trait has different ways of manifesting, I guess. But the attachment that we have early on in life. Right? I'm talking about the primary caregivers. I'm talking about mom, dad, or whatever that dynamic looks like, whether it's just a dad, whether it's a mom, whether it's grandparents, adopted parents, whatever it is, whoever those people are, they have a significant and profound impact on developing resiliency the appropriate way, or increasing resiliency, or increasing that trait at a time long before a lot of this traumatic stuff potentially has happened to an individual.
I like that.
I think you can increase resiliency prior to the trauma.
Yeah, it should be. So if we're
proactively.
Yeah.
But most people that struggle with mental illness or addiction, they come from homes in which that never happened.
Exactly.
If anything, the opposite happened, which was the traumatic events. So now they're just kind of like left like raw nerve. But I will say this, and it's a good analogy for the audience to listen to, is, if somebody is born in a specific language and it's their main language they speak as a child, right? Mm-hmm. They typically pick up that language, and it could be multiple languages, and they could speak it without any type of accent. They could speak it fluently in conversation. They can read it. They can understand it. They can comprehend it. Okay. Now let's say that person never learned that language ever in their life, right? They were never exposed to the right elements to be able to learn it the proper way. And now they're 30, 40 years old, and they say, you know what, I want to learn this language. I would never tell that person, well, yeah, you missed the boat over there, because by teaching and by learning and by exposing yourself to certain, the language and the word and how that conversation goes, you might be able to speak that language. You're going to have a heck of an accent, and you're not going to be able to speak it. They're going to know that it's a language that you kind of just force-fed yourself to learn. But guess what? You can travel to a country and you can speak to people in their language. And that's what I believe is the same thing happening to teaching people resiliency.
So that actually, if you look at it that way, it's also very much in line with the way I look at substance abuse. At some level, those initial coping mechanisms you had, which were pathological anyway,
sure,
or saying your coping mechanisms were never put in place. I think it's all saying the same thing. And at some point, the drugs became the coping mechanism. Even if you don't recognize that, that's what's really going on. Because you're trying to you're mistaking euphoria for an egosyntonic state. And so now, as an adult, you're for the first time learning coping mechanisms. That itself takes resilience, because it's change. And fundamentally, we think of it as ability to adapt. Negative event, but any event is change.
Yeah.
And you have to gain those new tools. And so in that sense, I think it's important to utilize it for the substance abuse, mental health, marginalized, anybody really, to be able to cope. And even if you think about it, the rapid rate of change of the complexity of the world that a person has to deal with requires resilience to have any kind of success.
Yeah.
And I think in the substance abuse patients, they should recognize, if it's never been told to them, you are extremely resilient at many levels, right? The stuff a lot of people have had to do to survive using drugs as a coping mechanism is resilience. Overcoming it, staying alive, and engaging in the world in a normal way, I use that term very light, is resilience. It also shows ability to learn, right?